Greetings. My name is Arif Khan. I'm based in Abu Dhabi, and it's my pleasure to share with you our experience with the syndrome of retinal arterial macroaneurysms with supravalvular pulmonic stenosis in the United Arab Emirates. This is the first time this condition is being described outside of Saudi Arabia. Our story begins with an 11-year-old Emirati girl who was referred because of vitreous hemorrhage. By the time she came to us, the hemorrhage had cleared, and the notable findings were in the posterior pole of both eyes. In the left eye, you can see a fibrosed, involuted macroaneurysm on the disc. In addition, the arterioles are thick-walled and beaded in both eyes. These findings are almost pathognomonic for the syndrome of RAMSVPS. And again, this has only been previously described in Saudi Arabia before, associated with a single founder pathogenic variant. We did genetic testing for this Emirati girl with attention to that particular gene, and sure enough, she was found to be homozygous for the Saudi splice variant in IGF-BP7, the only variant that has been associated with this phenotype. Systemic evaluation uncovered supravalvular pulmonic stenosis, and segregation analysis uncovered an asymptomatic sibling who was also homozygous for the variant. We examined him, and again, his significant findings were in the posterior pole of both eyes. He also had an involuted aneurysm on the disc. He also had prominent arterioles with beading, and in addition, there is an inferior temporal area of a fibrotic vessel associated with inner retinal thinning, suggestive of prior hemorrhage in this area. Right eye again shows the arteriolar thickening and beading. Echocardiogram confirmed him to also have previously undiagnosed supravalvular pulmonic stenosis. So this is a fascinating syndrome. These patients come in as children or young adults from visual loss because of retinal bleeding from the macroaneurysms. The important thing about this condition is the extraocular manifestations, because if they are not detected and addressed, they can be a cause of premature death. Initial misdiagnosis is very common in this condition, even though the ophthalmic features are distinct. That's understandable because of its rarity. Every single patient who's been genetically tested with this condition has had the same homozygous IGF-BP7 splice variant. I show this picture of a 26-year-old affected Saudi female because it's a nice example of the different stages the arterioles go through in this condition, from beading to macroaneurysm development, to macroaneurysm bleeding and leaking of exudate, to involution of the macroaneurysm, to vascular sheathing. Interestingly, soon after we saw the first family, we became aware of another family. The older brother in this family had been diagnosed with atypical Coates disease and also had a macular scar in the right eye that had been attributed to trauma. In fact, he has the classic features of this condition. The retinal arterial features are pathognomonic. The macular fibrosis in the right eye is almost certainly from prior subretinal. Left eye, you can see a leaking macular aneurysm with a subretinal hemorrhage surrounding it. In the periphery, there are some focal Coates-like dilatations. We sometimes see that in this condition. His sister was seen for strabismus, was diagnosed with atypical Coates disease. She actually had a history of supravalvular pulmonic stenosis before she had eye complaints. And again, she's got the classic arteriolar features with leaking of the vessels. This is pathognomonic for the condition. I think the most interesting patient in this series is their 4-year-old cousin. She was diagnosed with Coates disease in the left eye, as you can see, at 15 months of age, treated with laser, and the exudates dried up very nicely. The right eye was thought to be normal, but in fact, in retrospect, when we look carefully, you can see some subtle retinal arteriolar beading. Here she is at 4 years old. The exudates are dried up after the laser treatment, and the beading is more prominent. To summarize, I've shared with you our experience with retinal arterial macroaneurysms with supravalvular pulmonic stenosis in the United Arab Emirates. This is the first time this condition has been described outside of Saudi Arabia. Every single genetically tested patient has had the same homozygous splice variant in IGF-BP7. These patients are almost always misdiagnosed initially, but it is important to recognize them as soon as possible, because if the extraocular features are not attended to, it can be a source of premature death. I look forward to hearing other reports of this condition from other parts of the world. Thank you very much.